today we are smack dab in the middle of the month. And it's the middle of the 10th month of the year. If you have set some resolutions and you're wondering where you are, well, this is the time to do a check because we are almost at the end of 2025.
You,
My, how
Lady
time
Elise,
flies.
Lady Elise, that it is as if it's time to start playing Christmas carols
Time has
already.
flied.
It's time to start playing
Time has
Christmas.
flown. Thank you. Yes.
It's time to start playing Christmas carols as we know it.
Okay. It's time to.
Start playing Christmas carols.
Oh, yes. It is
Christmas
time.
carols, yes, that's where we are now. And so, for those who don't know, for those who don't know, it's almost at that time.
It's beginning to look a lot like
Christmas,
Christmas.
yes.
Yes. Toys in every
It was
store.
it was just a little bit a while ago that it was Christmas already. Can you imagine? You know,
Yes.
and I said to myself, this year is going to be one of those years that, we get to do so many things, and you're going to plan this and you plan that, and I can guarantee you, if you didn't start planning immediately as the year start, and you delayed a second and did not follow up, you are at October 15th, and you still haven't started yet. you know.
Yes.
And so I have seen many of my friends who have said, we're going to set some New Year's resolutions, and we're going to do this and we're going to do that. I'm going to follow up and check on them now, because I'm sure that half of those resolutions have disappeared before they started. So I just make some plans for myself. Some of them fell through, some of them came through, some new ones came up, but we had to be deliberate in ensuring that we continued. We had a yearly plan calendar. We had started our yearly planning, and we got to the 6 months of it, and now we have 4 months of the year left, approximately, or a little less than that. And so that last quarter, we are actually into it, and we have a few plans that needs to be
I
finalized.
didn't get. Did you say we have 4 months left in the year?
I was saying the last quarter is 3 months, actually. Yeah, my apologies. So I'm actually saying it is at this point 3 months to date for the year to end, as far as
Three
I'm concerned.
months. I think you're still over. It's less than 3 months, Mikey G.
Well,
That's
give
how
and
fast.
take, give and take, give and take a
Yes.
few days.
Yes.
Give and take a few days. But this is what I'm saying. And so we have a few things to do at the end of the year, plan a few things, and so we can do that. Of course, if you did not start planning, and now it's time to start planning for the Christmas period for those who celebrate Christmas. Because do you know that many persons do not celebrate Christmas?
I do. I
Right,
don't know.
right. And so we have persons who do not celebrate Christmas, so it's not a thing. Nobody going to get no Christmas preparation, and of course Santa Claus is definitely coming to town. All right. So having said that, I'm gonna ask Mario.
You mean
I'm going to
it's
ask Mario
after
to.
dark?
I'm going to ask Mario after that, man, to be the Santa for Flashpoint. I'm going to dress him up. Let's dress up Mario as Santa at the front of
Oh,
Flashpoint.
are you serious?
Yes, I'm serious. Yeah, he could be a good Santa Claus for
It
for
could be a
for.
good Santa.
Yes, yes, he has
Today is
lots of
National
gifts.
Brooch
He
Day.
has
I don't
lots
know.
of gifts to give away, and I don't know. He will smile a little with the kids. Yeah.
Not with the conversations he's been having after dark. No
No, no,
Santa.
these are not the kids' conversation. Anyways, what we're going to do is we're going to go for a devotional, and of course, when we come back.
Good morning. This is day 15. You do not know what will happen tomorrow. James chapter 4, verse 14. Nothing is ever sure. Written by Dennis de Haan. In November 1975, the huge freighter Edmund Fitzgerald sank in the cold waters of Lake Superior during a fierce storm. Only a week before the tragedy, Chief Steward Robert Rafferty had written to his wife, I may be home by November 8th. However, nothing is ever sure. The prophetic irony of his words was noted in a newspaper article listing the 29 crew members who perished in the disaster. Not a day passes without a reminder that our earthly life can end at any moment. All we need to do is read the obituary column. One message comes through loud and clear. We're here today, but we may be gone tomorrow. What is your life? It is even a vapor that appears for a little time and then vanishes away. Is our only certainty then the sobering prospect that Christ is the anchor of the soul? He paid the penalty for our sins on the cross. If we admit our guilt before God, we will receive forgiveness and eternal life by trusting Him. He has promised to remain with us even in the hour of death. Does your earthly life seem futile because nothing is ever sure? Then trust Christ. He provides a joyous certainty about eternity that can be yours right now. Life is uncertain. Death is sure. Sin is the cause. Christ is the cure. Our quote this morning reads, it's never too soon to accept Christ, but at any moment, it could be too late. End quote.
I'm Audley Scott, and you're listening to Flashpoint Radio. Rise and shine, your morning boost of inspiration, news, and fun. With Mikey G, Lady Elise, and Coralee Karen, the unmistakable combination synergized to navigate.
Of course, welcome back, welcome back, welcome back. Yes, yes, yes. Devotional was interesting. You know, every day we get up, you know, we find it easy to have this conversation.
Yes.
And sometimes we figure out that we don't have all the answers at all, Lady Elise. They are not there. None of the answers we don't have. But
No.
in every time we get one of these devotionals, it gives us a little bit more encouragement. So I want to thank Susan Long for always giving us these great advice and, of course, bringing some real solemn bit of sobering thoughts to our minds each and every
Just
morning.
2 to 3 minutes every day, Mikey G, and so profound and so important to take you through the 24 hours. These just little pearls of inspiration just come to give us the encouragement that we need. Yesterday we studied about evangelism being a dirty word, and the analogy with salesperson. And whether we like it or not, we are salespersons. I want to say a big hello to, of course, the pastor here of the Maranatha and Ephesus Church, Pastor Vaughn Henry, who I bumped into yesterday.
Oh.
And I say big hello to you this morning. He was certainly giving us some encouraging words, and we want to thank you for that. I want to say thank you publicly. But on another note, just to remind the listeners that there is a lot happening, not only locally, but on the international scene. And one day that is celebrated, Mikey G, that maybe you never knew existed and is celebrated every third Wednesday in October, and that is Bra Day USA. That's ERA day.
Bra, you mean
Yeah.
like the bra that women wear? That's what you're talking about.
Yes, but this bra,
And
yes.
so if you celebrate it, do when they celebrate the bra day, do everybody wear the just don't wear anything else but bra all day, just the bra.
But listen to the history,
No, no,
right?
I know the
From
history. I don't know the history yet, but I just want to ask if that's how it works. If do you go out, don't wear any other garments, but just wear your bra just to show off the bra that you have for the day.
Well, not this day,
Okay,
not this time.
all right.
This day, yes, was started in 2011 by Dr. Mitchell Brown, a Canadian plastic surgeon, and the event expanded to the United States in 2012 as Bra Day
Okay,
USA.
wow.
And of course, it has to do with breast reconstruction. Yes, breast reconstruction surgery and awareness. So it's breast reconstruction awareness. And so, as October is celebrated as Breast Cancer Awareness Month, a lot of women have to make the decision, should I, after mastectomy, do I need to do a breast reconstruction so that at least you might be, looking how you used to look? And of course, that's a decision that many women who are faced with breast cancer and after mastectomy or lumpectomy,
What
decision that need to be made. So, breast
construction
Reconstruction
day? What do you call?
Awareness Day.
What do
That's
you?
BRA, Bra Day USA, third Wednesday in October
What
every
about
year.
those ladies who have perfectly great breasts, or they are nothing is wrong with it, and they cut it out and put silicone and all sorts of stuff in there?
Well,
Just
that's a conversation we could have. You're talking about cosmetic
it's
surgery.
not the same thing we're talking about.
Eh, Cosmetic surgery. No, it's different. People, and then we could probably have a wellness Wednesday where we explore that, because there are a variety of breast surgeries. Persons do breast implants, not necessarily because of any, but to want to change the size and the
That's what I'm
appearance.
saying. I'm not saying that the person is ill or anything. The person have no
No, they're
sickness at
not
all.
ill.
They
Yes,
just go ahead, get the doctor, get the knife out, slice it open, and take all the stuff out, and then put some stuff in there to say, now you have great boobs, sort of thing. And people spend lots of money for doing that to themselves.
yes.
All right. Of course, this conversation can be one that I don't
All
want
right,
to.
so people do reduction and enlargement. Yes, they might reduce it if it's too big. And remember, the reduction too, sometimes if the size of the breast can cause other issues like back pain and other.
You can
So if
imagine.
there is an
It cause
abnormal
some
enlargement,
of those sides of those breasts cause headache too. Some men just have headache all day when they see them. But I will say this to you, Lady Elise, that for me, I would say this for me, I would say I don't understand how it is possible for someone to do something. I don't know how. But anyways, having said that, I think it's about
anyway,
time.
it is Wellness Wednesday, and Dr. K stands ready to speak to us on whatever she's going to speak to us about today, Mikey G.
All right, so you know what? When we come back, let's talk about that when we come back.
Thank you. Of course, welcome back. We are joined by Dr. K, our resident physician. Yes, flashpoint of doctor. Yes. Of course, she has been sharing with us each and every Wednesday, and we have coined it Wellness Wednesday, always sharing pearls of wisdom, pearls of medical wisdom to help us to stay healthy and, of course, eventually wealthy. There's no health, there is no wealth without health. So, of course, Dr. K joins us this morning, and we are happy to welcome her. Morning, Dr. K. How are you?
Good morning, Lady Elise. Good morning, Mikey G. How are you
Well,
this
I,
morning?
I'm fine, thank you. And I was just about to say, Lady Elise, give me a chance. Let me just welcome Dr. Kina. But then since she went ahead and welcomed you, and then you asked me, I'm saying, thank you for asking. I am feeling fine this morning. It's a great morning. And so it's Wellness Wednesday again for me to learn a little bit more about my health and how I can stay healthier. Yesterday, we talked a little bit about financial health and how much more we should invest. And so today, we are thinking about if you are going to be talking a little bit more about how we can invest in our health. And I'm not sure what you're going to be talking to us about this morning, but I'm all ears and I'm waiting for the conversation this morning. So thank you, Dr. K, for coming on this morning. And of course, grace us once again.
Okay, so the month of October, we discussed last week sudden cardiac arrest, which was quite interesting because we realized that cardiac arrest is not exactly a heart attack. It's two different things. They're two different things. One is plumbing and one is electrical. And that we can save a life by learning CPR. Now, this Wednesday, today, we're going to be having an awareness of Down syndrome because October is Down syndrome awareness. And so we're going to be talking a little bit about Down syndrome. It might not affect me, it might not affect you, but it might affect somebody that you know, or you might decide that you want to be pregnant, and Down syndrome is one of the common causes of abnormalities in childhood or birth defects. Now, what is Down syndrome? I'm sure almost everybody has seen a child who has Down syndrome. You've seen it on television, in your neighborhood, or wherever you have seen it. But Down syndrome is basically one of those genetic conditions. And what it is that there's unusual cell division, right? And because of the unusual cell division, there's an extra copy, it could be full or partial, of the chromosome 21. So we have 23 chromosomes, right? So we have 1, 2, 3, 23. And so we have two pairs, a pair of each. So making us having 46. Okay? So with Down syndrome, they have an extra pair. Okay? And so they would end up having 47. And because of the extra chromosomes, so they have extra, instead of having two sets of chromosome 21, they have three. So that's how you end up with the extra. And because of this extra chromosome, what happens is that there are changes in how the child develops. Okay? Now, there's no real cause of Down syndrome. They're not sure what really caused the egg to unusually divide. However, we know that older eggs are more likely to have this change. Okay? Older eggs are more likely to have this change in the chromosome division.
Doc, as you said, older eggs, could you explain what you mean by older
I mean,
eggs could actually
older
do that?
eggs mean that persons 35 years old and older are more likely to have Down syndrome. But because more people less than 35 get pregnant and there are more babies born to people less than 35, Down syndrome tend to be more common in younger persons. Do you understand?
No, say that again. Say that again, Doc.
So people with 35-year-old and older
Yes.
are more likely to have division of their eggs and get the abnormality, which is the trisomy 21, the extra pair or the extra set of the chromosome 21. So
Yes.
people older than 35 are more likely to have Down syndrome. However, because more pregnancies occur in people less than 35, Down syndrome tends to be more common in that age group. Do you understand? So less people have babies over 35. But if you're over 35, you're at increased risk of having a Down's baby.
Less people have children
Over
under.
35 than under 35. So if you have a population of 10,000 women, probably 1,000 women will have children over 35. The other 9,000 people will be having children when they're younger than 35.
Mm,
So what will happen is because the 1,000 will have more risk of having Down syndrome, but that's only 1,000. Say all of them have Down children with
right,
Down syndrome. That's
right.
1,000. But the younger persons, because there are more pregnancies, you might get 1,500 Down syndrome babies in that group of the 9,000 persons.
Oh, so you see, younger people still produces Down syndrome children.
Correct, but it's more common in people older than 35.
It's more common. Okay, but so
Correct.
you're saying that people, less persons in are choosing to have children at an older age. But what I'm looking at now, I think there's a shift in the dynamics of this conversation, that where lots of women now in this dispensation, this era, is now choosing to have children later in their lives after 35 rather than having children before 35. And we have linked that to career driven ambitious ambitions. And so that is really a part of the conversation now, that women no longer want to have children too early. And so we have seen a spike in women having children later in their lives than in earlier. So I don't know what the statistics is now, if it's more women doing it, but it's a trend that's going that direction.
Okay. All right. So that's what causes Down syndrome. So we understand that is a genetic mutation, genetic cell division with an extra pair of chromosome, and there are other causes, but this is the most common cause. So instead of 46 chromosome, which is 23 pairs, they have 47 because they have an extra one. And as a result of that, what happens is that these children are born a little different. So a woman who is over 35 and is pregnant, her doctor will tell her or advise her or request of her to get genetic testing in pregnancy. So what will happen is that they will take amniotic fluid and they will or do an ultrasound and they will check for features of Down syndrome. Okay? And this does not change the outcome because the baby is already formed. So all it does is that it educates you and also prepare you for the fact that you might have a Down's baby, and also put you in support groups or even point you towards those areas where you can get support in order to deal with a baby with that chromosomal defect. Okay, so nobody's gonna say you're gonna have a Down syndrome, let's get rid of the baby. But they're going to be telling you that the likelihood is that your baby is going to be formed with these abnormalities, and then you will get you'll be advised or even get that support that you need in order to know what to do. Now, Down syndrome has a number. Children born with Down syndrome tend to have a number of um, syndromes and symptoms. So the symptoms could be physical, it could be cognitive, means with their brain, and it could be behavioral. And not everybody are born with the same syndrome. It differs from person to person. So you have very low functioning persons with Down syndrome and very high functioning persons with Down syndrome. In fact, with all the therapies and all the awareness now and the treatment, the ability to get treatment, now people with Down syndrome can live to over 60 years old. There was a time when they're more likely to live for less than 60 years old, but now they're actually living for older. What are the issues with Down syndrome? So the issue is that they do look a little different, right? So the physical signs are a little different because they have this flat nose bridge. The eyes tend to be slanted upwards. I'm sure you've seen them. The neck tend to be a little short. They have small ears, small hands, small feet, and they tend to be a little weaker at birth, and they tend to be a little bit shorter than the average height. Now, because of the difference in their body, these babies or these children or these persons are at risk for many different things. They're at risk for hearing loss. They're at risk for vision problems. They're at risk for dental problems. They're more prone to getting infections, and they also, because of the issues with their neck and their cervical spine, they're at risk for getting damages to their cervical spine and also sleep apnea. And almost quite the majority of children with Down syndrome have heart defects, which a lot of times can be corrected early in life. And sometimes there are a number of repeated surgeries in order to help to alleviate these issues. Sometimes it goes on into adulthood. But the problem with Down syndrome is that these children tend to, their fine and gross motor skills are delayed. So they tend to walk later in life. Okay? Their speech is delayed. So they realize that they take they take long to talk. So your child will start talking at probably 1, 2. They're going to be talking much, much later.
Mm.
Okay, the way they learn is different, the way they play is different. Okay, and as a result of that, these children tend to be delayed potty training, so you will take a while, they'll be in diapers for a longer while than other children. And sometimes you have to feed them for longer because they're not eating food as independent as children who are in terms of their normal behavior. And in terms of behavior, you might think that they're stubborn. And one of the reasons is because of the delay in their language and the delay in a lot of their cognitive skills. What happens is that these children tend to throw tantrums, and they tend to what we call a little bit stubborn, and they're delayed in paying attention, and they might have obs, obsessive compulsive disorder. So yes, these are things that parents have to deal with, and sometimes as onlookers and people around, we're not as sensitive and as tolerant to these children because their behavior is not the same. As do you expect them to sit around, not move around as much, but they are, if something is happening and they want something, they'll scream out, they'll cry, they'll throw tantrums for it
Mm.
because it's hard for them to express themselves and say, I want this. And some children are able to because, as I say, it's a syndrome, and they're different. This is a different level of development with these children, even though they have the same, disease, when the entity, well, the same abnormality. Let's put it as an abnormality. Now, the thing about Down syndrome is that you wonder, can children who have Down syndrome have children?
Mm. No, that's I've never, Doc, as you said that a while ago, I've never seen a Down syndrome mother before. I have never seen one. I possibly have
Uh,
seen a Down syndrome father. I'm not sure of a mother. I can't even remember. As you said that, I am now thinking about it a lot. Yeah, yeah,
so,
yeah.
persons with Down syndrome can have children. Women are more likely to have children than men because men tend to have decreased fertility. So there is two persons with Down syndrome who come together, and the women, they can have children. But I said a Down syndrome woman is more likely to have children than a Down syndrome father. Most times, because of the genetic predisposition. So, what puts you at risk for having Down syndrome? If a parent had Down syndrome, if the parent had Down syndrome, the child is at risk, and it says about 35 to 45% at risk. If you've had a child with a Down syndrome, then you're more likely to have another one with Down syndrome. And older age puts you at risk too. And so we talk about parents having a child and also increasing age. So those are the factors that really put you at risk. How can you prevent Down syndrome? I mean, there's really no way to prevent from having Down syndrome. I mean, all we know is that once it happens, and then the child and the parent, because remember, you're dealing with a child that has a lot of issues. It's not very easy. And sometimes there are children that are unable, or the children who are unable to function independently as adults. And sometimes they need assistance in terms of their daily life, financial assistance, and so they may not be able to be independent of somebody else. They have to depend on somebody for care, for food. They may not be able to work and be independent, so somebody will always have to support them. And sometimes this go well into adulthood. There are some persons with Down syndrome who can have a job and who can actually function independently, and there are the others who are unable to function independently. But the thing about it is that there's help available, and for children who are born with Down syndrome, it's usually an entire team that helps to work with the child, and the team is the first of all, you have your cardiologist, you have your pediatricians, you have your endocrinologists, because Down syndrome persons are at risk, as I said, for infections. They're at risk for increased cancers, for immune disorders, for thyroid issues, and a number of other things that will cause them to have a team of medical persons to care for them. So they will have persons with their eyes because they have some ophthalmologists and eye specialists because they have problems with their eyes. They may have learning, hearing, sorry, abnormalities. So they might need a doctor or person involved with hearing. And they're going to need speech therapy to help them to communicate, and also physical therapy. Because remember, as I said to you, their muscles tend to be a little bit weaker than usual. So they need to improve their motor skills, their gross motor skills, and their fine motor skills is not as developed, and it's tend to be delayed. And sometimes they have behavioral therapies because, of course, there's an emotional component to it, and so they need to be able to not have outbursts of anger and be disruptive. So they need behavioral therapists, and so there's a number of persons involved in their care. And because they have all of these abnormalities, it puts a strain on the caregivers who are usually the parents. And think about you having a child that may need you for the rest of this child's life.
Wow.
And so your child will live up to 60 years old, and you had the child when you were 35. So your child, you have to be at least 95 and older in order to outlive your child. Okay, because you want to outlive your child, because you don't want to leave your child, because you're thinking that, oh, if I die, my child will die, because somebody has to take on the care for your child, because the child is unable
Unable
to
to take
care
care of
for
himself.
him or herself
Yes.
into adulthood. And then, because there's so many issues, as I said before, um, these children can become autistic, and also Alzheimer's has an increase has an increase, or these persons are at an increased risk for getting Alzheimer's disease, usually less than 40. There can be onset of Alzheimer's. So there are so many things that happens when a person has a child with Down syndrome, and that's why October has been designated Down Syndrome Awareness Month. And as I said to you before, you might not be affected by it, but then you might know somebody and you might be able to point them in the direction that there's help available. They have to care for that child. Their Down syndrome. There's a whole lot of um, facilities that will assist in caring or even educating parents and family members and caregivers in terms of how to deal with a person with Down syndrome. And this is from beginning. The earlier the therapy starts, the better it is for the child and the more independent this child will become in life. And that's exactly what the aim is. The aim is for the child to be as independent as possible. Not that the child will not depend on the parents, but if you can get a child who can earn, who can learn, who can at least get a skill, do something, than just sitting around and not being able to communicate or have so many abnormalities, then yes, this is a case where we are aware we can point somebody to the right direction or in the right direction in order to get help and also to be a source of support, because help is needed. Support is always needed in this case.
Wow.
Thank you so much, Dr. K. As you were speaking about um, the fact that it's a team effort, the family member, the speech therapist, the pediatrician, the endocrinologist. I remember the first time I saw an independent person who had Down syndrome, and I think I was visited the US, and I was assisted in a store and ably assisted by someone who had Down syndrome, because sometimes, as persons in a busy world, we are quick to sometimes exclude persons who have challenges, right? And I'm happy for where we are at now, that these individuals can function and function well given the appropriate tools. So, the fact that persons have challenges, I'm glad that resources are now available to assist persons in functioning in society, because, of course, we know how overwhelming it can be for not only the mother, but the father, the parents, when they have a child who is not the perfect child. They were anticipating the birth of a perfect child, and then you recognize that, there are some challenges, and that in itself may cause persons to be discouraged. But I'm thankful, Dr. K, that you shared with us so much information, so that persons who may feel overwhelmed, and I think there are support groups. Here at Flashpoint, we remember being a part of, I think, the T21 association. The form is an NPO right here in the Grand K, and they have an awareness group and a support group here quite active in the Cayman Islands, because persons, yes, they're born with challenges, but certainly all hope is not lost.
Well, also I want to say, just to add my quota of thank you, Doc, for the presentation this morning. And of course, as you mentioned, awareness and where persons can get the information and become aware of this and become more knowledgeable. I would want to say that Flashpoint has been a beacon of hope, and of course, have been sounding the alarm for many, many years on this platform about this. As you mentioned about old eggs, to tell, I would say, Doc, and as we are talking about it, while we are seeing the trend going up for women to now delay childbearing to older age after 35 when they have old eggs, we are saying, Flashpoint is saying, be smart, please have your children earlier, despite the fact that you said that persons who are younger also can have Down syndrome children, but less likely to do so because it is just not natural for that to happen all the time. But for the old eggs persons who are older than 35, who wait until that time, delay the childbearing experience to choose a career before having children and having old eggs now, I believe that they are going to be the ones responsible for the majority of Down syndrome children and autistic children. And I think that we as Flashpoint are bringing the message, and we are encouraging our ladies to understand the parameters that they're operating in, and please don't harm the children anymore. Please, thank you. That's what I
As
would
we
say.
said, Mikey, before, there's still a lot of research that's being done or ongoing in terms of the cause. So we can't say that because you're older, you're gonna have Down syndrome, or you should have your children younger because you're at risk for. Yes, it's not the ideal when you're older for you to have children, but depends on the care that you give to your body. Remember, pregnancy or even childbearing and having healthy children starts long before you thought about getting pregnant. The way you take care of your body all your life is going to determine a lot of times the outcome of your baby. Because the thing about it, eugenics is something that's important. That's good beginning.
Yes.
And good beginning starts out very, very early. So in order for women, even if they decide to be younger or older, to have children, they need to take care of their bodies. And this is important in any woman who decides or even is desirous of having children.
Well, all right, Doc. Here's the final question. I just asked this one, and I mentioned the old eggs story. And of course, you would have explained that even women who have children before is less likely to have children defect if they had children before 35. Going on. It is better for them to start having children early. When they are 35, they are less likely to have any form of deformity in the kids. But if you start having them at 35 and older, you are the ones who are really setting up the children for having this. But like you said, that there are research going on, and now everybody wants to do this. But I want to say this to you, ask you this question, Doc. For the purpose of information and for a listening audience and for educational purposes, I'm going to ask this question, and if you could just answer me, and just for the persons who are listening, for them to get a full grasp of it. Best childbearing age, from what age to what age? Best childbearing age, please, from a doctor's perspective.
Okay, so the optimal age for having a child, right, is something that we always say it's early in life, because peak fertility tend to occur in late teens. So between 80s and early 20s is the peak fertility time. And we're
best time, Doc.
Right. 18 to 30.
18 to 30. All right, Doc, you have answered the question so eloquently and so precisely. I thank you for that one. And of course, like you said, we are a source of information to give to persons who are seeking information, who want to do better. And of course, he that have ear, let him hear. In fact, sorry, her that have ears, let her hear.
Yeah, but between 25 and 30 is really the best time in terms of fertility, and the lower health risk and increased stability. So yes, between 20 there's peak fertility. Fertility is high between late teens, and that is 18 to 30 years old. That's where a person is most fertile. But in terms of your stability, in terms of having less complications, less everything is usually between 25 and 30, but we always say 18 to 30. That's where childbearing tends to occur
Peak.
at the best time in
Peak.
life.
Yes. Doc, I want to thank you. Elise, if you have anything else you'd like to add.
You just got me on that repeating of that whole egg thing that I am just like stunned right now. Thank you, Dr. K. A wealth of information shared and also a lot of hope provided here on this breakfast hour. I want to thank you, as usual, for bringing so much depth and variety in topics. And the thing about the topics is not if it does not directly apply to you, then you can be a source of information, a source of support to others as well, because we are a community based station. I want to thank you so much, Dr. K. We look forward to hear more from you on the very next Wellness Wednesday. Thank you so much for your time and your effort and the energy and all the detail that you have put into the presentation.
All right, of course,
Thank you.
thank you.
Thank you.
Thank you, Doc. Of course, when we
Okay,
come.
so much. Enjoy the rest of your day.
Doc, thank you. I must say thank you for giving me the opportunity to have this conversation this morning. Old eggs.
Flashpoint Media present Point of Praise, Cayman's Got Talent, Gospel Edition, Saturday, October 25, 2025. Place to be, Triple C 74 Fairbanks Road, Georgetown, Grand Cayman. Tickets, pre-sold $25, VIP $50. Part proceeds to loud, solid voices. Be there.
Welcome back. It has been a wellness morning with a different. Sorry, guys. I am just stuck on one thing, but please don't beat up Mikey G too much. Listen to the information first. All right. Of course, we want to thank you for joining us. Elise, I see you still just looking at just there thinking a lot of stuff. What are you thinking, Elise? Let me hear that question.
Mikey G, I mean, as usual, we walked right into that one with our eyes wide open. But certainly a wealth of information being shared today on this Wellness Wednesday. A lot of information from our physician regarding Down syndrome. If you know someone who has a child who has this Down syndrome, all hope is not lost. It takes a community effort, of course, to help and be supportive, and sometimes we tend to be sometimes insensitive, I believe we might say,
yes.
Or but let us recognize that you have no control really over how you're born, where you're born, what you look like. Michael G, did you know that you would have that curly hair before you knew that you'd have that curly hair?
No, I didn't know I would have the curly hair, but my father knew,
Your father knew.
my mother knew I have curly hair.
There are so many things that we do not have control. That's the point I'm making. I want to thank our listeners and viewers. You do have control over what you watch, what you listen to, and we thank you that you have chosen to watch, to listen, to be a part of this episode of the Breakfast Hour.
so we thank you once again. Yes, of course, we want to thank you for joining us this morning for this edition of the Breakfast Hour. It is indeed a wonderful morning. And of course, as the discussion goes on, we talked a little bit about Down syndrome. And of course, it is indeed a birth defect. And of course, we talked a little bit about what conditions can cause these things. And we are asking that everyone please pay attention to this edition of the Breakfast Hour and try and see if you can mitigate against having your children later and try to have them earlier. All right, young people who are planning to have children, or if you're not planning to have children, don't plan to want to have them too late. Please. Please. That's all I'm going to say. Can I say it like that, Lady Elise? I can say it like that? All right. So like, share, and subscribe. Of course, remember, our web reader continues on www.flashpointmedia.ky. Of course, we wanted us to remind you of Cayman Got Talent. Of course, we have our Cayman Got Talent coming up on October 25th right here at the Triple C School right here in the Grand Cayman Islands. And of course, $25 is for adults, $10 for children, and $50 for VIP, $25 at the gate. Please don't be late. Come out early and buy your tickets now. Of course, those who are registering for the talent, for their showcase their talent, please, registration still open. Remember to call 1345-6969. That's the number to call right here at Flashpoint. Of course, registration continues. Lady Elise.
Yes, I want to thank all those persons who have registered so far. Indeed, it promises to be an exciting event, something you don't want to miss at all.
Thank you very much, guys. Have yourself a Flashpoint Day. Wellness Wednesday with a difference. See you tomorrow right here at Flashpoint.